Hello everyone, and welcome to this audio podcast synopsis. This is an audio podcast synopsis in around the series the molecular storm gauge the molecular storm gauge v.3. This is an audio podcast synopsis in around some works surrounding pediatric nephrology and coping in young people with chronic kidney disease (CKD). This is an audio podcast aligned to a storm lobostic siege, and in line to a storm lobostics production. And so what I thought I'd do here is sort of provide a synopsis in context of this sort of research that had taken place, original research that had taken place between 2010 and 2013. The works, the research, sort of the full publication can be accessible online through search engines, but also through the organisation, the Renal Patient Support Group, the RPSG, England, from through the RPSG sort of website, organisation website. The works was collaborative between the University of West of Scotland, the Department of Nephrology, pediatric nephrology at Birmingham Children's Hospital, NHS Foundation Trust, and a youth club based in Scotland, and also in around between through academia, and also through sort of services for young people, sort of with and without particular health concerns. And so in around this, the background in around this synopsis is that chronic kidney disease, or CKD, is an irreversible disease that has physiological, psychological, and psychosocial implications or challenges, especially for young people. The aims and objectives in around this research had been where the objective was based on a phenomenological investigation or study, and was to identify coping strategies in two groups of young people aged between 12 years and 18 years. And where in between those those sort of the age range between 12 years and 18 years, and in one group where young people were from a healthy cohort, so to speak, and the other being a cohort where there were CKD patients or recipients in CKD severity stages, or CKD severity or stages 4 and 5. So in around the design and the sort of design and methodology in around this research, young people with CKD, in context of young people with CKD, 7 young people had been recruited. 7 participants had been recruited with a mean age of 11.5 years of age, and young healthy people were recruited where there was seven young healthy volunteers who participated with a mean age of 14 years, where recruitment took place between as part of the methodology. Recruitment had taken place from the Birmingham Children's Hospital, the Birmingham Children's Hospital in the United Kingdom, and a youth club based in a city referred to as or known as Glasgow, Scotland, UK. And participants were invited to take part in a single or one sort of face-to-face semi-structured interview. The findings data analysis showed or identified 11 different themes, 11 different themes in and around and surrounding sort of coping sort of themes, or coping in line to a coping basis. In around the conclusions around this works. It can be concluded, or it was concluded from the interviews, that young people, that young healthy people, and those with chronic kidney disease or CKD alike, utilize a variety or a range of coping strategies. The themes derived the themes that have been derived in this works can prompt researchers or investigators to potentially develop a coping score for a young CKD population. However, a longitudinal investigation or study would help to recognize coping strategies young people adopt over time, and provide a pathway for the development of a formal coping framework. In around the literature, there are sort of some main terminologies that can be used in search engines online. For example, chronic kidney disease, coping, pediatrics, phenomenology, and young people, and a combination of these sort of terminologies, in applicable sort of search engines can help identify literature surrounding this research. And of course, in the descriptive online, the citation of this particular works can be identified, should be identifiable. However, this was works that was published peer review and published by Mohammed and team in 2015, and the research again was in around pediatric nephrology, coping in young people with chronic kidney disease, CKD, and the research was published in a journal that's a journal referred to as the Journal of Renal Care, or JORC. And once again, the work, the full research or the publication can be accessed through the RPSG and through particular search engines are online. So that's the synopsis, this audio podcast sort of synopsis in around this research that had taken place retrospectively between 2010 and 2013. This has been an audio podcast synopsis and an audio podcast sort of overview in and around the series, the Molecular Storm Gauge v.3, an audio podcast aligned to pediatric nephrology, coping in young people with chronic kidney disease or CKD. It's an audio podcast in and around a Ztorm Lobostics siege, and also another Ztorm Lobostics production. Thank you.